Hi, Dr. Sasse here from Sasse Surgical. And I've had a couple of people lately ask me, Dr. Sasse, tell me about weight loss surgery and pregnancy. What do I need to know? So there's a couple of things to cover here. So let me try to describe a little bit about what's been shown in the research literature, and then a few sort of take-home points at the very end if you hang in there till the end of this video. So first off, let me tell you the good news, and that is that there are many studies that have examined weight loss surgery in women of of childbearing age and following their pregnancies, and have even compared them to pregnancies without weight loss surgery. We have a lot of data going way back many years, and the take-home point here is that pregnancy is more likely, it's also way safer, and it's a way more successful after weight loss surgery for women who are thinking of getting pregnant and starting a family or adding to their family. So let's just unpack that a little bit. So first of all, it's way more likely. Actually, it's really common that as women gain weight, they sort of cross over this threshold where the body stops its normal ovulation process, and then infertility sets in. And so after weight loss surgery, the body weight comes below that threshold and ovulation kicks in again, and what do you know, pregnancy is really easy to happen. So I've had a lot of patients over many years who said, oh doc, I can't even get pregnant. And I've said, no, you know, what's happening is the physiology, and after weight loss surgery, it's very likely that you will get pregnant. And sure enough, that's what takes place. So we always, in fact, advise every single woman who is of childbearing years to have a really good birth control plan, and to sort of have a plan in place about family planning after weight loss surgery, because you know, unexpected pregnancy has become super possible. So much more likely to have pregnancy, and then much safer. So during pregnancy, when people are also battling obesity and morbid obesity, there are risks that come along with that pregnancy that affect both the mom and the baby. And those risks are dramatically reduced after weight loss surgery. The chief ones among them are gestational diabetes, but also eclampsia or preeclampsia, the combination of adverse effects during pregnancy that include high blood pressure and the effects that can come along with it, the severe swelling and so forth. For the baby, there are a number of risks also, this high birth weight and effects that happen to set the stage for the baby to then also be carrying forward this excess body weight that may translate into obesity later in life. So the pregnancy becomes a lot safer for both mom and baby, and then more successful in the sense that much more likely that the mom is able to have a successful pregnancy that's carried to term and has a normal delivery, and with no funny business and complications. And so those are the main findings. So in general, weight loss surgery is considered a very effective fertility treatment, and also one that reduces the risks of pregnancy and childbirth. So as we know, having any kind of surgery or going through anesthesia or all the things that come along with pregnancy and childbirth, it's better to do all of that at a lower, healthier, skinnier weight where there's just less risks and complications as a result. What else do we know about weight loss surgery and pregnancy? We know that the future pregnancies can have an adverse effect in terms of the hormonal storm that's created by pregnancy in undoing all the hard work you've done to lose the weight. So we think that weight loss surgery works by changing the underlying hormones that kind of set the flight plan, the set point of body weight and metabolism. But that's a somewhat fragile recipe that comes from our internal hormonal chemistry. And when pregnancy comes along, that is a huge hormonal storm that can cause a lot of weight gain, a lot of hunger, and undo all the hard work that's been done. So another bit of advice that we always offer to everyone at Sasse Surgical is that if you've had weight loss surgery and you're still planning to have more children, to have a real proactive game plan to not gain very much weight during subsequent pregnancies. And this sometimes kind of comes in conflict with what a lot of people are telling new moms. Oh, you're eating for two, it's okay to gain weight now, you're allowed. And so there's a kind of a permissiveness that doesn't normally exist. But I want to tell you that there's research that supports the idea that gaining only a very small amount of weight during pregnancy, like 10 to 15 pounds when you're already carrying excess weight, is healthier, again, for both mom and baby. And that then it's not this huge 50, 60 pound weight gain of pregnancy that's really hard to lose later. So you've done all this hard work to go through weight loss surgery. You've put down time, energy, money, effort, and lost a whole bunch of pounds. You don't want to see all that work undone by gaining a whole bunch of weight during pregnancy. So I think that it's very safe to move forward with pregnancy and more adding to the family, but do so with a plan in mind to maintain absolute maximum health. Make sure you're taking the bariatric vitamins, which is kind of a little above and beyond the prenatal vitamins, because usually it includes an extra vitamin D and a little bit more B vitamins in those. So that is the general lay of the land with respect to pregnancy and weight loss surgery and the research that has gone into studying both aspects of it. So in summary, I would just say that if you are having trouble getting pregnant, then weight loss surgery is an excellent and is the most effective fertility treatment, and it's arguably the most effective, probably safest, and the best risk reduction intervention for infertility in an overweight or obese mom, bringing risks down for both mom and baby. And then for future subsequent pregnancies, keep in mind that it's more likely that you'll get pregnant, and also much more important to have a game plan to stay on your vitamins and avoid the huge weight gain that can sometimes come along with pregnancy and can be hard to fight, but it's important to fight it. Okay, I hope that's been helpful, and I look forward to hearing from you in the future. And with that, I wish you the best of health.